More on the death of teenager Jeremy Webb, who's become the first Australian confirmed to have died from a tick-induced red meat allergy. Professor Sheryl van Nunen is an immunologist and allergist and was the clinician who posthumously diagnosed Jeremy with mammalian meat allergy. She says trying to prevent tick bites will stop this from happening.
Ticks contain a sugar called alpha-gal, and they inject that into us accidentally from her feeding space under our skin. And then the immune system is forced to make an antibody to that. And in 50% of people after 2 tick bites, they make allergy antibody to this. And then the person has the meat, which contains the allergen. And then about 3 to 6 hours later, they'll have an anaphylaxis or a lesser form of anaphylaxis. Or 1 to 2 hours afterwards, they'll have gut symptoms with nausea, abdominal pain, which is severe, and cramping, and then diarrhoea to follow that, and sometimes vomiting with it, Ross.
Why do some people develop this allergy and others don't?
It's an interesting question, and one that we've addressed by doing some research with Lifeblood Australia, looking at blood types in the northern region, in the northern beaches, and we've found that non-B blood type is a risk factor for the development of the allergy antibody to the alpha-gal sugar.
So you mentioned 2 tick bites there, so you're more susceptible to developing mammalian meat allergy if you have been bitten by ticks multiple times.
Well, I think that certainly 2 tick bites. You see people who've had 1 tick bite, and even from a larval tick, just had 1 episode and they've developed it. So it's more likely to occur after you've had 2. But there are people who've had 900 tick bites and haven't developed it, but they're very rare.
Is it getting easier to diagnose this tick-induced allergy?
Well, I think that the diagnosis it relies on the history from the patient and then a confirmatory blood test. So one of the difficulties with diagnosis is that the test itself is not enough. We have to have the clinical history that fits with it. So positive test for any allergy is a question and not an answer. And the question is this allergy important to this person at this time in their life? And does it explain the symptoms from which the patient's complaining? So they have to satisfy those criteria, because in actual fact, of the people who are sensitised to the mammalian meat allergen, only 15 to 20% of people will exhibit symptoms of clinical or may have symptoms of mammalian meat allergy.
Right. So what should people be aware of then after being bitten by a tick? What are the symptoms of an allergy induced by a tick bite?
Firstly, either the gut symptoms with the nausea, the cramping, abdominal pain about an hour or so after eating meat, and the diarrhoea to follow later, even the next day, sometimes vomiting. And if they have the other form, the systemic version, which is a typical allergic reaction, even up to the level of having an anaphylaxis, and unfortunately now, since Jeremy's, even fatalities. We've had fatalities with tick anaphylaxis in the past. And so, these allergies from the ticks, we need to have a proper, effective awareness with the public that tick bites can do all of this. And in actual fact, the problem with the meat is one thing, but around the world there have been 7 times the number of deaths than there have been to meat from medical improvements that we're giving people, treatments that we give people for this that contain mammalian product. So it's a very difficult situation.
Sheryl, there is a treatment available, is there, other than an EpiPen?
Well, the EpiPen, 2 EpiPens, 44.6% of Australians use more than 1 if they need to use their device, so we recommend 2 at all times. And I think the other part of that is that there's no treatment for this, because if you don't have another tick bite, it'll go away. The sugar molecule is not an incredibly strong allergen from the point of view of duration. So if you have no tick bites from any blood-sucking life stage of tick, no larval, no nymph, no adult tick bite, then within 3 to 4 years you can be back to normal and your level of the allergy antibody reduces. But if you have another tick bite, you'll double it with each tick bite. And if you lose it and have another tick bite after that, it'll come back again.